Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's episode, first off, low testosterone in men. What does it do to you, and when should you treat it? And then, Kathy Griffin pays over $200,000 for plastic surgery. What? I can't believe it. But it brings up a bigger question. What should plastic surgery cost? And then we got a new true malpractice story, a $25 million lawsuit against a doctor in a hospital for doing an unneeded mastectomy. This story's crazy, and it's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk, an honest and uncensored show about plastic surgery, health, beauty, and lifestyle, with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for tuning in, and we really do appreciate it. Please hit that like and subscribe button and turn on those notifications. I'm your host, plastic surgeon Dr. Bruce Hermann. With me, as always, is Sarah.
Hi.
Hi, Sarah. I think I scared her with that intro. It's a little energetic. Brenda, what's up? How are you? Brenda in the box.
Hello.
Producer. How have you been? Good week?
Yes. It's
yeah?
going good.
Yeah, lots of good shows this week.
I need to scoot over.
Oh yeah, you're doing the. You want me to scoot your chair over? Yeah.
The lean.
The lean. The Sarah lean. Yeah. Yeah. Everybody have a good week. Anything cool, exciting? Nothing for me. It was pretty just routine week.
Yeah, I don't think I did anything cool.
Nothing?
I'm trying to think.
Yeah, I'm actually off this weekend. I'm not on call.
Oh, that's nice.
I know. I'm gonna watch football tomorrow, and then my daughter has a birthday party, and I'm DJing her party because we need a DJ and we don't have one. So
DJ Dr. Hermann.
She's I have like the full setup.
I would never let one of my parents DJ
dude,
my party.
I have like the full. I have
teenager.
I have all that professional music gear, and I have CDJs and like the whole thing. So I don't think it'll be bad. I've done a little DJ.
It'll be cute.
So that'll be fun.
It'll be cute.
All right, let's jump into some segments. So normally we do a lot of segments for women, being a show about plastic surgery, but every once in a while we got one for the men. And ladies, don't tune out just yet, because you know how guys are. Like sometimes they don't go to the doctor, and you might be able to help out a significant other. But this is actually a very hot topic. I'm kind of surprised we haven't done this one. This was about low testosterone in men, the effects that it has, and when you might consider treating it. So, and I'm really surprised we haven't talked about it. This is actually all in the news all the time, and I don't know. Maybe because we always focus on the plastics and stuff. And
yeah, maybe.
I write for one of the local papers, and this was like a kind of a, I don't want to say it was requested, but it's like one of the topics that was thrown out there. And I was like, oh yeah, I'll write an article. I was like, this would be a great segment for the show.
I know a lot of men are getting on testosterone earlier and earlier. Like my dad took it in his older age, but I know guys that take it like younger.
Yeah, it happens. Well, and it's important, and we're going to go over all this, but I mean, you don't want to take it if you don't need it, because there are downsides.
Right.
So there is a process to it. All right, so when you're in your 20s, you got that limitless energy, obviously, and as we all know, that starts to wane as we get older. But in men, sometimes, they get hit harder, and oftentimes guys don't want to go to the doctor. They'll be like, oh, it's just stress, or it's my job. Or maybe I'm just getting older, right? But sometimes it is a medical reason. As we all know, we have hormones that affect our bodies, and sometimes low testosterone can be the results of why men, as they are getting into their 30s, 40s, 50s, or older, don't quite feel the same.
Right.
So first off, what does testosterone do? Well, I mean, I have to admit that when I was doing the review for this segment, or when I was writing my article like a week ago, even I didn't realize how many different things testosterone does. Because we all think of it as like the sex drug, right? It drives your sexual drive, and it causes sperm development and all that. But it actually influences almost every body system that we have. So increasing muscle mass and bone density, that one's pretty known, I guess. Increases your red blood cells, regulates body fat distribution, okay? Yeah. Blood sugar control, I didn't know that one. Cardiovascular health, mood, knew that one. Cognitive function, didn't know that one. And motivation. And so, when your testosterone gets off, and you can actually have all kinds of symptoms.
Right.
Right? It's not just, I'm not interested in, sexual activity. I mean, it could be all kinds of stuff. So obviously these levels are highest when we're in our teens and our 20s, but when you hit 30 years old, your testosterone starts to drop. And it's not a lot. It's about 1% per year. Okay. So, but that stacks up over the decades, and a 20% drop from 30 to 50, which I am right now. I mean, that's pretty significant. And in addition, it doesn't always drop in the same in everybody. Some people it drops more. Also with hormones, sometimes people are more or less sensitive to them. So there's like a big variation in how people might respond to testosterone. Is the building on fire? Can you guys hear that? There's a big difference in how men might respond to low testosterone. And again, when people have symptoms, it can kind of run the gamut. There's a lot of different things that can happen. But some of the most common things that people talk about is persistent fatigue, decreased strength and endurance. So those, kind of make sense. Weight gain, depressed mood, decreased sexual drive, and decreased motivation and concentration issues. But then it gets kind of cloudy though, because those are pretty basic symptoms. They're not really specific. And so the difficult part comes in trying to determine, is this really low testosterone versus... Or is it
just somebody being unhealthy?
Yeah, it could be a lot of, you're right, it's a lot of different medical issues it could be. Because there are a lot of things that can cause those. So poor sleep, like if you don't get a lot of sleep, you can have the same exact symptoms. Increased stress, if you have like a really stressful job. Thyroid issues can also give you the same thing. Right. And then depression's the other one. If you're clinically depressed, you can have these symptoms, and it can mimic the issues that when your testosterone is low. So all of this boils down to if you're a guy and you're having these symptoms and you're in that kind of age bracket. So I would say over 30. I mean, most people, do you know people in their 20s taking testosterone? I don't. No. I know a lot of people that are older than taking it, but I haven't heard of people in their 20s. But if you're in your 30s and you're having these symptoms, the smartest thing to do is go see your doctor.
Yeah, get that blood work done.
Because I think, and maybe you know more about this, I kind of feel like there's these low T pop-ups that may or may not be run by doctors. Is that?
Like a pop-up, like a pop-up shop?
Like a pop-up med spa kind of thing.
Yeah, I don't know.
Wellness. I could have sworn I've seen some of those. Well, and Brenna, I feel like you're about to weigh in. Have you seen these pop-ups?
I have a question.
Okay, go ahead. What's your question?
What about if guys are taking steroids? What's the difference?
So anabolic steroids would also be a form of testosterone. Now that's going to be a lot different than if you're replacing your testosterone. I don't know the specifics of.
I think it's like a really
anabolic steroids. Yeah, I think that's
a really heavy dose of testosterone.
Yeah, in general, taking anabolic steroids is a bad idea. Yeah. And I can't tell you very specifically.
I'm trying to think of that one that people used to take when I was in high school.
There's a name for it?
Yeah, they had a name for it.
Is it like a street name, or is it like a legit medical?
No, it was a name of the drug.
Roids.
Yeah.
Roids.
That's what people call them, at least in college, the frat guys that I know of.
Yeah, taking the roids.
I forget
Wait, you
what
have hemorrhoids?
called.
No, like steroids. Oh, okay.
No, there was a brand name of
There's a brand name one.
thing that guys would take, and I remember, I just remember them being
the
able to
steroids.
take it. Yeah.
Yeah.
I forget.
I knew
what
people
it's
that took
called.
steroids too, but I don't remember them calling a certain name. Obviously, I never took steroids.
It was a brand name.
Huh?
It was a brand name.
A brand name.
Or
Was
something, or a name of the medicine or something. What?
Andro.
Is it Andro?
No, it was something else.
I don't know. See if you can come up with it. So, yeah, if you are a guy, though, and you think your testosterone is low, it's far and away the best thing to do is go and talk to your doctor, because what they really need to do is they need to take a really detailed history, and they need to figure out if your symptoms are coming from something else. Because, again, you don't want to take testosterone extra if your testosterone levels are normal. So there's a couple ways that they're going to go about this. They're going to take a detailed history, make sure that depression's not an issue, potentially check things like your thyroid, ask about your sleep habits, your stress. But then it boils down to they are going to test your testosterone levels.
Yeah.
So testosterone fluctuates a lot. Highest levels are usually in the morning, so they typically take a morning testosterone level. And what the criteria is, and this is where it gets kind of gray too, because I was looking at the differences in testosterone levels, by decade, like 20s, 30s, or 40s. Mm-hmm. The ranges are enormous, but basically there's like a floor, right? And so if your testosterone falls below 300 nanograms per deciliter and you have symptoms, that generally meets the criteria for you have low T.
Right.
So they do oftentimes take a repeat test though, because again, testosterone can fluctuate. So, if you came in at 295, they'd probably say, well, come check it, and who knows, and maybe the next day it's 400 and it's not actually low. But if your testosterone really is low, there are a lot of options for testosterone replacement therapy. And I haven't taken these personally. It's not something I've done, but if you talk to people that have done it, they say it's an absolute game changer.
Right. Yeah.
If their testosterone is actually low and they're getting the symptoms from it, taking testosterone is like flipping a light switch. You know, and I could see how that happens. You know, when something like that starts to go down, it's usually not you falling off a cliff, right? It's like the boiling the frog in a pot of water. You don't put them in boiling water. It's like you heat it up gradually.
Yeah.
And so the same thing would probably happen if your testosterone was gradually getting lower. You know, it's not like you go from feeling great to like terrible. It's like just over time you feel a little bit
worse. Yeah, you wake up and realize.
Yeah, it's like, geez, man, like what happened to me? I can't even get out of bed.
Yeah.
So the people that get it replaced say it's an absolute game changer. And there's a lot of ways to do it. There's like topical gels, which can be done either daily, weekly, or bi-weekly. The one I always hear about is the pellets. Again, I haven't.
For rabbits?
No, like they're injectable pellets. They put them under your skin. Yeah, it's like a little needle, and they inject it on your skin, and it's like slow release. I've heard of people, or I know people that are using those. And then apparently there's nasal sprays nowadays. And of course, if you do start testosterone replacement, it is important to continue following up with your doctor to get your levels checked. Because you don't want it to go up to like 2,000 or something crazy.
Yeah.
Because there are risks for taking testosterone. Most of the common risks are pretty minor. So the most common things are increased red blood cells, which makes sense because it stimulates red blood cell growth. Acne, that makes sense. Remember like when in college, like all the steroid pumpers would have like zits all over them?
Yeah, all over their backs.
Yeah, right, exactly. Yeah, I remember that. So acne, fluid retention is another one. There's two other like side notes with the side effects or potential issues. There is a lot of debate about taking testosterone replacement and cardiovascular health because there were some early studies out there that said that the risk of cardiovascular events went up if you took testosterone. However, that is now in question because some of the newer studies actually say the opposite. They say that if you're at risk for cardiovascular events and you have low testosterone and you replace it, you're actually less likely to have issues. So
that makes sense.
Yeah, I don't know. I mean, when something like that, when you have studies that are contradicting each other, almost always I find that the truth lies somewhere in the middle. It probably doesn't have that whole lot of effect because you got one study that says it helps and one that says it hurts. The last thing to note is prostate cancer. So although testosterone does not increase the risk of you getting prostate cancer, if you have prostate cancer already and you take testosterone, it'll grow faster, which is bad. So like if you were, say, 50s or 60s, thinking about starting testosterone replacement, they most likely would check a PSA, the prostate stimulating antigen.
Okay.
I really had to dig deep for that one. I'm not a urologist. So that is an important thing to know. But yeah, I mean, kind of the summary on this one is, testosterone replacement therapy isn't for everyone, but if you truly have low testosterone and you have symptoms, replacing it can be a game-changing event,
Yeah.
So, and I hear the same thing with like some of the estrogen and stuff. I don't know as much about those.
Yeah, there's blockers too.
For what? Testosterone?
For estrogen. And
estrogen, yeah.
And testosterone.
And right, yeah, there are.
When
yes,
they're not balanced correctly.
Right, because you don't want to get like the man boobs. Nobody likes man boobs.
Nobody wants that.
Yeah, nobody likes
you
that.
You might, because then you can take them off.
Right, I can take them off, yeah. All right, Brenna, let me recap this one. So today we were talking about a topic for the men, but don't tune out women because, men don't like to go to the doctor, so you might be able to diagnose your significant other. Today we were talking about low testosterone in men, what the effects are, and when you might treat it. So as you may or may not know, testosterone is a hormone that men have that is classically associated with sexual function. However, it actually affects many, many systems in our body, such as cardiovascular health, blood cells, bone, muscle, our motivation, our mood. It actually affects many, many things. And when we turn about 30, our testosterone levels start to drop by about 1% per year, which is not a lot, but it does stack up over the decades. Some men are more susceptible to the drop and some men lose more than 1%. If you have low testosterone, it can actually cause some pretty severe symptoms, but they're kind of general symptoms, nothing specific. A lot of fatigue, low motivation, things that affect your cognition, fat distribution. So there's a lot of things that it can affect, and these things often mimic other issues like depression or stress or low sleep. So it is important, if you think you have low testosterone, to go and see your doctor, get a good history and physical. They can check your levels, and if they find you truly are in low testosterone, you can get testosterone replacement, which there's many different forms of that, and people say it is a game changer. If you really have low T and you replace it, you'll feel like a new person. So yeah, leave us a comment if you want to know any more about that. Cool. I feel like we have to toss the guys a bone every once in a while.
Yeah, sometimes.
We got to talk about some guy stuff.
We'll do
All right,
it.
Let's jump into, well, this one's kind of for everyone, but more for women. You guys may have seen this, Brenna, Sarah. Did you guys hear about Kathy Griffin in the news this past week?
I see her all the time, like plastic surgery stories, because she's known to have a lot of plastic surgery.
Yeah, I've definitely heard of her.
Yeah. Well, did you hear the one from this past week? It's like unbelievable.
No, I haven't.
So she was, so 65-year-old Kathy Griffin, comedian, actress, was in the news a lot this week. It popped up. A lot of people were sending me this because like, you need to do a segment on this. So she was on the Good Guys podcast. I haven't heard of that one. You guys heard of the Good Guys?
Sounds familiar.
Sounds vaguely familiar, yeah. So she was on the Good Guys podcast, and she made this pretty shocking revelation, which makes for a great segment. So this is about Kathy Griffin's $218,000 facelift, which brings up the big question of how much should plastic surgery cost? Probably not $218,000. Like, that's bonkers.
That is crazy.
I couldn't even believe it. I mean, wow.
Was this her after it?
Yes, that's actually her. And I have another picture. So,
okay.
So go up and throw the next one. I mean, I looked at her facelift. Yeah. So, I mean, she looks good. I mean, it's a good facelift. I mean, is it $218,000 good?
Definitely not.
I don't think so. Like, I mean, I saw a lot of pictures of her, and I was like, yeah, it's good. I mean,
you've got to do a story on Kris Jenner's facelift.
You know, I need to, because you're not.
I've told you so many times. Yours is like so good. And
all right, I will
she's
look at it
like,
for next week.
she's gonna make the plastic surgeon that did that like so much money. She literally looks like 20 years younger.
Really?
Without a doubt.
Well, I mean, that's what a facelift should do. Like, that's what they do.
She doesn't look like somebody. She doesn't look like somebody put like plastic wrap on her face and squished it backwards.
Right, and therein lies the difference in good plastic surgery.
She looks great.
And not good plastic surgery is, you know, and I say this literally all the time, that, you know, the best plastic surgery is a plastic surgery that no one can pick out or no one knows you've had.
She literally looks just like Kim Kardashian now, like in the face.
All right, I'm going to look into it.
They look almost exactly
that came
the
up
same.
And I was like, oh, she had
They all look like sisters now.
Wow, all right, I'll check it out. I will have to say that there was another odd thing about Kathy Griffin's facelift. This is her third facelift at 65. Like, that's not normal. I mean, the whole purpose of a facelift is you really just want to
take it too far.
Do it once. I mean, I mean, if she's had to have 3 facelifts, I mean, that really means that her first 2 were not good facelifts.
Yeah.
I mean,
have you seen Ozzy Osbourne's
Sharon?
wife? Yeah, in a while.
No, not lately. Why?
I know she's like obviously gone through a horrible event in her life, but
yeah,
her
face
is looking rough.
Not good. Yeah.
I
haven't seen it. I'll check it out. Yeah, so absolutely bonkers the price she paid for this. I looked up her surgeon. I've never heard of him, which, I mean, sort of means something, but doesn't. Like, there's a couple names that are out there that are kind of like the celebrity plastic surgeons.
Yeah.
This guy's not even a plastic surgeon, actually. I looked him up. He's an ENT doctor that did a facial fellowship, which is fairly common. There's a lot of ENT doctors that'll do like a short fellowship and then jump into facial aesthetics.
Oh, because it starts with like nose jobs.
Yeah, right. Yeah, but the thing is like, you know, ENT doctors do 0 facelifts or aesthetics like in their training.
Yeah.
And then, you know, the reason I don't love like ENT doctors doing plastics is because unless they do a plastics fellowship, which is pretty common. Like, one of my best friends is a plastic surgeon, but he did ENT and then did a full plastic surgery fellowship, which is okay, that makes you a legit plastic surgeon. But if you don't do a full training program, then you have no idea like how good of a training they did, because it's not an accredited program. So I'm always wary of these ENT doctors that are masquerading as plastic surgeons. Obviously, this guy has at least got good marketing because he's getting people to pay $200,000 for a facelift.
Lord.
But yeah, I mean, the fact that she's had 3 is pretty wild. And then just the cost is insane. So I thought would be a good second half of this segment is to talk about what plastic surgery actually costs. Because I'm sure people probably see that 218. I mean, obviously everyone looks at that and be like, okay, this is like an insane number, but like, what's a real number? Mm-hmm. You know, I think a lot of people don't know it. So I actually had my office pull up quotes for a lot of different surgeries, and then I pulled up the national averages of surgeries, and so I'm just gonna go over them. But you guys are gonna have to guess.
Okay.
I'm sure you guys are probably pretty close. So, so a little bit about like the pricing. So I'm going to basically tell you, and these aren't to the exact penny, but they're very, very close. So, you know, my practice is in the Dallas Metroplex, for those who, you know, don't know where I'm at. But I am in the suburbs. I'm not in Dallas. I'm on the north end of the metro. And I'm kind of in a unique spot because where I have my practice is not really a super expensive place to run a business in general, comparatively. Mm-hmm. You know, because you ran a business there. Yeah. I mean, it's not terrible there, but there is a lot of money around it. Mm-hmm. So it's kind of like a sweet spot because I'm able to actually have very low prices for the Metroplex. And the reason I know that is because it's very common now for people to do multiple consults. So we'll have people come in and say, yeah, I did a consult in Dallas, I did one in South Lake, and I come to see you, and oh, by the way, your prices are really, really, you know, good. Yeah. Comparatively. I estimated that ours are probably, or like, it's probably 50% more closer into Dallas. My office manager thought it might be more. Anyway, all right, let's jump to it. Okay, so let's start off with the one that she had, facelift and neck lift. Okay. So, and it's kind of hard to do this because there are a lot of different variations of facelifts. And I included neck lift. I don't know if she had a neck lift. I almost always do neck lift when I do facelift because the incisions are exactly the same. It's like, why in the world would you not? Mm-hmm. It takes very little time to add a neck lift to a facelift, so I almost always do them together. And again, these are hard because you don't know exactly how they're doing it. But all right, Sarah, Brenna, you guys can pick who goes first. This is all in cost, not surgeon fee. This is all in OR, anesthesia, surgeon fee, all follow-ups. What do you think let's just say, what do you think the average cost is in the United States? And then I'll tell what mine is. All in.
12,000.
Good guess. Brenna?
Oh, I was going to say like 6,000, but now I'm second guessing.
You should second guess. Okay, here, I'll just tell you. All
15. Right. I'll go 15.
Wow, what a very good comeback answer because that is exactly correct. Gosh. That is exactly correct. So this one's
1 point for me.
This one's kind of funny. So the national average, after me looking at multiple articles, is around 15,000. The range is stated at 10 to 40,000. Okay, again, you know, because I know that when Kathy got hers, she had some fat grafting to her face, so that adds to the cost. And so, yeah, I don't really love fat grafting in the face personally, but I know it's somewhat popular. Okay, so actually my cost and the average cost were right in line. Okay. Our cost for facelift, neck lift, all ends around 15,000. So yeah, pretty close on that one. All right, let's do another one. Let's do breast augmentation. So just breast augmentation, no lift or anything. Breast augmentation, implants, surgeon fee, anesthesia, all your follow-ups, OR time. What do you think? Make Brenda go first. I feel like Brenda got that one right because she. What do you think?
Oh, this is a random guess for me too. Okay. I feel like it's gonna be more.
You think more?
Yeah. No? Oh.
It's a shorter case. And the OR time is money, but there is the cost of the implants, so that's a little bit of a factor too. Okay. It's not a huge deal.
I'll say like 10,000.
I say 8.
Brennan, good job. It's 10,000. That's exactly right. Well, wow. Okay, that's my cost. Okay. National average is 9 to 10. So you guys are both about right there. So 9 to 10. The range being 6 to 12. Again,
mine were like 2,000. I swear mine were like so much cheaper.
Dude,
but
I'm telling you,
done like
our price for an AUG in 2019 was around 6. Oh. Like the costs have gone.
And it was in Georgia.
The cost of the implants have gone up. The cost of OR time has gone up. Like our costs have had to gone up because everything like we have to pay for has gone up. Like it's insane how much plastic surgery's got more expensive. Yeah. Okay, what about breast lift? So this is a mastectomy, breast lift, all in. No implants on this one, but it's a little bit longer case. Sarah, why don't you go first? I made Brenna go first last
time. 12.
Okay.
Again.
Brenna?
You said longer case, so probably more. I'll do 13.
Okay. I probably threw you guys off. It is a longer case than an AUG, but there's no cost of the implants.
Oh.
So for a breast lift, all in, national average 8,000. Our price is 9.5. So we're a little higher than national average on that one. But I do like the most advanced types of lift, do short scars, so like we can demand a little bit more money because we do something not everyone does. All right, this is a really common one. Tummy tucks. Tummy tuck, all in, everything. So no implants on this one, a little bit longer case. What do you guys think? You guys are all right in there, so.
I think it's more expensive. I just know from, like, it's just a lot moving around down there.
It's a fair amount of work. A tummy tuck takes me 3 to 4 hours to do.
This one's hard. I don't know if I should go more or less. I'm going to say 8,000.
Ooh.
You should probably go more.
Okay, then 12,000.
That's pretty close.
Okay.
Yeah, so national average is exactly 12,000. Actually, we come in a little low on tummies. Our all-in cost is 11.5. National average is 12. All right, last one, liposuction. You want to go get some liposuction. Now, this one also is hard because it depends on how many areas you're getting and how big the areas are. We don't charge as much to lipo someone's chin as we do to the tummy because obviously it's a lot bigger even though it's one area. But just for fun, throw out like either 1 or 2 areas of liposuction, how much do you think it's going to cost? These are fairly quick cases.
For 1 or 2?
Yeah, just say 1 or 2.
1,000.
$1,000?
Yeah, I don't know.
No, it's more than that.
5,000.
All right, you guys are way off, but it's okay. All right, so liposuction.
Less than 10.
1 to 2 areas, 7 to 10,000.
Oh, okay.
It varies because, again, if I'm doing liposuction here versus the whole abdomen, it's both one area, but obviously liposuction in the chin doesn't take as much time.
That's wild that it costed the same as like a boob job.
I agree.
For 2, so like if it was one area, it'd be closer to 7, so it'd be less. Like, but the thing is like you starting to get in time with lipo because a lot of people want to do their hips or their flanks, so you have to position them in one position, prep, drape, do it, break everything down, flip them, prep, drape, do it, break everything down, and then you'll just do the front. So it ends up being a fair amount of OR time, but the costs are not high because there's no implants. You know, it's still less than the other ones. So, but yeah, basically, you know, the numbers are more than they were for sure 5 years ago, but not crazy. I mean, I don't know, everything's relative. Some people may look at $10,000 and be like, that's insane, I'd never pay that. But it is what it is. I mean, a new car is like, what, at least 30 or 40,000, right? So it's like, I mean, in the scheme of inflation and how much things cost, not bad. I was actually really interested to see that our prices, like my personal prices, are very kind of on spot with the national average. Which makes sense. I mean, you know, obviously in Dallas, things are going to be way more expensive than national average, but we're kind of on the suburbs, so we're able to offer a little bit lower prices.
So what's your like cheapest procedure? The smallest or easiest?
Probably the cheapest thing I do commonly is probably earlobe repair. Yeah.
Me soon, hopefully.
Yeah, anytime you want. Yeah,
Yay.
we can do that. I mean, it takes almost no time, no implants, you know. Plus, nobody's going to pay thousands for an earlobe repair, so... You know, I mean,
sense.
Yeah.
I wouldn't like to.
Probably the cheapest, yeah.
At least until I pay off student loans. But
if you want your earlobe fixed, I'll make sure we do that. Like,
Perfect.
we'll find a time and it'll be super cheap. So, but yeah, I just thought it was interesting. Like, you know, but that guy's in Beverly Hills. He's only doing. I guarantee though, I will bet you any amount of money. If Kathy Griffin wasn't a celebrity and she rolled into this dude's office, there's no way that he's charging her $200,000. Like, I bet you anything, he's like. Charging more for celebrities.
So that was how much it cost for one procedure?
Allegedly. That's what she said on the podcast. $218,000.
I could see that, like, how she's, like, had 3, and it's, like, equaled out that much.
It's just crazy. No, that was one. That was the last one. $218,000.
I want to see a before of her.
Yeah.
I'll have to look into that.
And again, I looked at her facelift and I was like, well,
Kathy to all of her plastics.
It's like, it looks.
Yeah, because she's done a lot over time.
It looks okay, but man, I don't know. All right, let me recap this one real quick, Britta. Today, we were talking about the insane story of Kathy Griffin paying $218,000 for facelift. What? Who pays that much? That is absolutely insane numbers. In fact, that is over 10 times the national average for a facelift. It was also her third facelift, which is really weird at 65. I mean, you generally don't have to repeat facelift. So there's a lot to unpack there. But what we did talk about is the actual price of surgeries. In fact, I pulled a lot of our surgeries that we do, including facelift, augmentation, tummy tucks, lipo, breast lift, and all that, and actually told what my prices are. And it was really interesting. I pulled the national averages, and our prices are actually really close in line to the national average. Of course, we're in Dallas where things are more expensive, but my practice is kind of on the edge of the Metroplex, so I can be a little bit cheaper. But it was a really good segment. So if you want to know what plastic surgery actually costs, I actually quoted my prices. You can check out that full segment. So, okay, last segment. This one is kind of crazy. This story is really, really bonkers, and it is not out of Florida or California. I know you're going to ask right off the bat. So this is kind of along the lines of the True Malpractice series that we've been doing. I didn't think of it that way because this is just getting started. It's not ended, so we don't have like the end result. But this is a segment about a $25 million lawsuit over a woman who got unneeded mastectomies, and it gets even worse. Wow, this one is pretty crazy. So it actually, and this is all the information I'm about to tell you comes from the news articles. A lot of this stuff is alleged, but there are court documents, so we're just reporting what's out there, folks. So it starts out a bit weird. Patient Mandy Moore had a deflated saline breast implant, all right? Decided she wanted to have her breast implants out. And this happened in 2023. So this went down a couple years ago, so it takes about that long for all the lawsuits and all that to kind of like show up. So she didn't go to a plastic surgeon, which is weird. I don't know why someone would not go to a plastic surgeon if they had a breast implant, because obviously the plastic surgeon put them in. She went to the Richmond Breast Center in Virginia. Oh, did I say where it was? It's Virginia.
No.
Okay, Virginia. And now we know Virginia. Usually a lot of you don't get a lot of weird plastic surgery stories out of Virginia.
No.
I'm kind of disappointed in Virginia for this one. Went to the Richmond Breast Center, which that's also weird because when you talk about a breast center, yes, it is. Very good, Sarah. It's almost always for treating cancer or medical breast issues. It's never come get your breast lift or breast implants. Now, sometimes they will have a plastic surgeon on staff to help do the reconstructions. Not always, though. Most plastic surgeons, most breast centers don't employ a plastic surgeon. They just have some that they work with. Okay. So it is weird that she went to this breast center. Very, very weird. So she went in there, and this is, I watched the video of her talking. She's like, I just want to have my breast implants out. That's all I'm here for. Okay. Well, they did a couple studies, mammogram or whatever, and a nurse practitioner comes in and tells her, I got bad news. If you don't get a mastectomy right away, you are absolutely 100% going to get cancer. So this lady freaks out and basically gets allegedly talked into having mastectomies by a nurse practitioner, which makes no sense, gets hooked up with this surgeon, Dr. Espino. I've got a picture of Dr. Espino because she was on the news. I just kind of threw it up there if you want to see her. Yep, there's Dr. Espino. So Dr. Espino comes in just 5 days before the surgery schedules to meet the patient for the first time, which is weird because generally if something really big like, hey, you need to have mastectomy is about to go down, the surgeon would be the one that's talking to you, and apparently that's not how this one happened. So Dr. Espino takes this patient to surgery, and this is where it gets wild, and did both her mastectomies and her reconstruction, which is why that's weird because Dr. Espino is a general surgeon. She's not a plastic surgeon. She's not a plastic surgeon at all. She did what most general surgeons do, which is do a fellowship in breast, but that is a breast cancer fellowship. Has nothing to do with plastic surgery or reconstruction. And it's really wild that the hospital let her do that because there's no form or fashion that I can ever envision that she should have privileges to do breast reconstruction.
Right.
She didn't do training for breast reconstruction. She doesn't have board certification for breast reconstruction. So the hospital screwed the pooch big time on this one. As somebody who does malpractice consulting, they're screwed. This is a huge problem. There's no way that she should have privileges for breast recon. So, as would be expected with somebody who doesn't have training doing breast reconstruction, which by the way is very hard. I, at one point in my career, did a ton of breast reconstruction. I still do it. I don't do quite as much as I used to. It is very hard. It is much easier to do cosmetics. The reconstruction, because you're having mastectomies, is a shock to that area, and then you're trying to do a super complex surgery, and when you combine those two things of I'm traumatized in the area, but then also doing something very complex, complications happen. Yeah. You know, it's very hard. You definitely don't want somebody that's not properly trained to do it. Well,
so she messed it up.
Yeah, it went badly. Like, it didn't go into a ton of detail, but like the implants ended up not where they're supposed to be. Okay. She had multiple reoperations. At one point, like all her incisions broke down. I mean, it was apparently like a 4-alarm goat rodeo. And then one day the surgeon just didn't show up. It's like she like left town like suddenly. Yeah, right. So this poor lady gets all these surgeries. All of them went badly. And here comes the worst part. So she follows back up at the Richmond Breast Center, and she sees her new surgeon. You know, they hire a new surgeon. And this surgeon, I can't believe this, comes in and tells her, you didn't need mastectomies. I looked at your chart, and I have no idea why that last surgeon did this to you. Like, there's nothing in your chart, in any of your tests that indicate that you're about to...
What about the nurse practitioner? Where's she at? The one that told her that she needed it.
I mean, at the end of the day, it falls on the surgeon. You know, because the surgeon agreed with it, you know, that this lady needed to have mastectomies. And after someone who looked at it that was other than her said, no, there's no way. Like, you have a slight risk increase of breast cancer. Like, she didn't have BRCA. That's the one thing I want to know is, like, did she have BRCA? No, she'd already been tested for BRCA, which BRCA is the breast cancer gene, which if you have BRCA, you need mastectomies yesterday, even if you're like 30 years old. Because when people get breast cancer with BRCA...
Isn't that what like Angelina Jolie did? She like tested her...
I think she had BRCA. She was BRCA positive. Yeah,
yeah, she tested her genes and she had hers
Yeah, if you have BRCA, you want to get... But she did not have BRCA. She didn't have any other of the genes that are like high risk for breast cancer. She basically had like a slight family history of breast cancer, which means, okay, you have a little bit increased risk. But yeah, the surgeon basically came in and said, I don't know what that surgeon was thinking, but you did not need all these surgeries that they did, which they did, and then they botched you. So obviously, she's very, very unhappy about all that.
Hopefully she's gonna
file a $25 million lawsuit.
Yeah.
Yeah, she did. In fact, the news company had an independent surgeon look at it, and they said the exact same thing. Or maybe he was like one of the experts like me. I don't know. It was a little fuzzy who this guy was, but they brought in a different surgeon that looked at the medical records and like, yeah, this is a total catastrophe. So, yeah. I have a lot of problems with this. I mean, I have two big problems. One, this lady got talked into surgery she didn't need. I don't think that there was any question about her not needing it. I mean, from what I looked at, from what was available, there was nothing really that would indicate she needed mastectomies at all. And I'm just, you know, I mean, I'm involved in breast cancer as a reconstruction, but I still have like some of the, you know, background and who needs what. And this lady didn't need that. So I hate that for her. She was coerced, probably for money.
That's what I was going to ask. I was like, is this to file insurance claims?
Yeah, of course. Yeah, absolutely.
They needed to do?
I mean, I don't know, but why else would someone coerce someone into having surgery? I mean, that's the only reason I can think of. I mean, is money. That's what the news people said. They were like, this was done for money. But then the worst part is
silly because it's like that should be something they do all the time. So it's just
like why coerce someone into? I have no idea. I mean, there are situations where surgeons get bonuses for production. I don't know. I mean, I'm not saying that's what happened, but you know, when you think of it like that, it's like, okay, if you do X number of surgeries in a year and you're going to get an extra 100K or whatever, then you're, you know, everything you see is somebody who needs surgery, maybe. I don't know.
Is it like hitting quota or something?
Maybe, yeah, quota. I mean, there are some of those contracts are, say, if you don't do enough that you don't get paid, or, you know, I mean, that's why I'm not an employee, because it gets really kind of sticky. But then the worst part is you have a general surgeon doing a surgery that they're absolutely not qualified to do. Like, I mean, what in the world? Like, why would that person think that they can do a reconstruction case? Like, she had no training in that. Like,
who's in charge of her?
Well, she's an employee of this place, but like the hospital should have prevented her from doing it.
What I'm saying.
The hospital. I mean, I catch flack from. There's one hospital I work at. I won't name them, but like they give me grief about doing stuff I've been doing for 15 years. You know, I actually had to go and fight with the administration about a case that I've done probably 30 times. I just hadn't done one recently, and they're like, "Yeah, you don't have privileges for that." I'm like, I'm a reconstruction surgeon. Like, and not only that, I've been doing reconstruction for 15 years in private practice. They're like, well, you know, and so like I'm getting grief for doing something that's like bread and butter plastic surgery and have to prove that, you know, I'm capable by producing numbers. And then you have another hospital that, yeah, sure, you want to do reconstruction? Yeah, go for it. You think you can do it? You can.
You interned somewhere for a week, so yeah, you can cut
absolutely.
You can cut somebody up.
Well,
no big deal.
I have a prediction that this case will not go to court. This will 100% settle because neither that doctor nor the hospital, I think, is going to want this to go to court because they look terrible and they're going to fight it and lose. And so I bet, I don't know, I bet they will probably settle out of court. Probably not for $25 million, but
yeah.
But that lady's getting paid. Like,
and she'll probably have some good-looking boobs.
I don't know, man. It depends on how bad she got messed up. Yeah, it's crazy though. Like, I don't know. I read stuff and I'm just like, how does that happen? But then you hear things like Dr. Death, that guy running around killing people, you know, in Dallas.
Oh yeah.
That Dunch or whatever his name was. That guy's still in prison.
Really? I watched that documentary.
Pretty wild.
Weird.
Yeah. Yeah. We listened to it in the OR one time when we were doing a long case.
Yeah, he was on drugs too, wasn't he?
Probably. Yeah, he was messed up. That guy was wild. All right, let me recap this last segment. Today we were talking about another true malpractice story. This one is actually just getting started. This is really crazy out of Virginia, where a very nice lady had a deflated saline breast implant, went into the local breast center, which is kind of weird. She should have gone to a plastic surgeon, but maybe she got confused. Went to a breast center, which historically treats cancer. And she got the shocking news that she needed to have mastectomies right away or she was absolutely going to get cancer. This is what she's telling, you know, everybody and in the court documents. So she basically gets talked into having a double mastectomy and reconstruction on a very short time frame, meets the doctor very shortly before the surgery is about to happen. And the crazy part is this doctor, Dr. Espino, who's a general surgeon, did her mastectomies and her reconstruction, which doesn't happen. And of course, the reconstruction went really badly. She had multiple surgeries to try to fix it, never really got resolution. The surgeon ended up leaving town. And then the crazy part is the surgeon that replaced that surgeon told the patient that no, she actually did not need mastectomies and had no idea why the surgeon did the mastectomies. It's just absolutely insane story, mismanagement, doing surgeries that shouldn't have been done, and people operating out of their scope, general surgeon doing reconstruction, all bad. There's now a $25 million lawsuit against the doctor and the facilities involved. I mentioned I think this one's going to settle. I don't think this goes to court because it's just kind of overwhelming. But we will see, and we'll update you. All right.
It's a lot of money.
Sarah, it's a good show today.
Yeah, good job.
You did good. You always like you're chiming in there. Brenda? Good? You good?
Yes, that was fun. I liked guessing the prices.
You were really like...
I impressed myself.
You were like hot and cold. Like you either like were way off or right on the money. It was good. Yeah.
Thank you.
Yeah, good job. All right. Well, we really appreciate you guys tuning in. Thank you so much. If you want us to talk about any specific topics, please leave us a comment. If we see a comment about a topic, we'll do it. And we'll talk about it on the next episode of Nip Talk.
Bye.